This podcast is part of the Frederick Podcast Network. Learn more at listenfrederick.com.
That's number one. You kind of reset your
Painful, tender to the touch. May also
same shoulder length and the other.
Welcome back. It's another episode of the Real Health Podcast with Brandi and Amir. I'm Dr. Amir Rashidian, a chiropractor. Brandi Rashidian is my other half. And today we're going to continue talking about some health stuff and get you ready to enjoy a nice spring, hopefully.
Oh,
the weather's going to get warm.
I know. I'm excited about that.
But I'm not talking like in June, but like it's going to be unseasonably warm in a little bit.
Yeah.
Well, by the time this airs, it might have passed. We may be in the middle of another snowstorm. You know, in Maryland, it used to snow only in October and April.
Really?
That's how it was. Weird stuff.
Let's not blame it on global warming.
No, that got fixed with this administration. You saw how cold it was for inauguration last year?
Yeah.
They had to take it inside. This first time inauguration was held indoors because it was sub-zero temperatures.
Probably
People were like, on his first day, he fixed global warming.
That's hilarious.
And then we ended up having the coldest winter we've had in, I don't know, decades.
Yeah.
And more snow than we've had in years.
I know. Yeah, it's been a lot.
It's crazy. You know, when your kids say, I don't want any more snow, that's when you know you've had too much.
Exactly. Unless it's going to we have one that's still in school. So he's like, I would take a snowstorm. I said, listen, while everyone else,
He's the one that didn't shovel anything.
Correct. Yes. And he thinks he's going to get these days off. And the county took so many days off. They were so jealous of the county, because they didn't get the same schedule. And I'm like, they're going to be going whale into June, and you're going to be out enjoying your summer. So you'll be fine. Did you hear that whale? I got a little southern twang on that. I don't know where that came from.
Oh, yeah. I was wondering what a whale was. Talking about the country whales?
A Kansas whale.
Okay.
Sometimes my Midwestern accent.
Kansas does have whales.
No.
They're
Well,
land whales.
land whales, yes. Okay.
Anyways, it's a southern cooking or whatever. Kansas had good barbecue, that's for sure.
We do have good barbecue.
Well, listen, the Frederick Podcast Network is what the Real Health Podcast is brought to you by, and it's found on listenfrederick.com and YouTube, Spotify, and iHeart, iTunes. And our purpose is to bring you information that will help you feel better, get stronger, live longer, and feel younger. And I was thinking we would start with this information. Now, this information came out a week ago, but I think it's relevant and it's just interesting. So We'll lead off with this. It's a little bit of a controversial one.
Ooh, let me have it.
We're going to get a little political on this one. If you don't like politics, you can skip.
Yeah, just forward.
Or if you have little kids, just kidding. We're not going to use bad words.
Yeah.
We're going to want to use bad words.
I might smack the table.
That's not going to bother them. It's going to bother Sean.
Yeah, sorry, Sean.
Because he has to work with the audio on that one.
That's
Wait,
true.
what did Sean say he wanted as a pet? Oh, as seal. What was it? Otter? Sea lion. I don't know the difference between a seal and a sea lion. So
I think one has ears and one has ear holes.
that's right. Whichever
I could be
one.
making that up.
So
But I remember something from when I was in the splash zone the last time at Hershey Park.
because we were talking about pets. Anyways,
Yes.
this is not warm and fuzzy stuff. So
Yeah.
hang tight. This was on New York Times. 15 states sue the Trump administration over vaccine schedule revisions. Now, I don't think they're suing the Trump administration. I think they're suing the Health and Human Services, Department of Health and Human Services. So is that considered part of Trump administration? I mean, he did appoint RFK Jr. to lead the HHS.
It's weird to me.
It's very funny. So you're like, so I wanted to know what those 15 states were. I'll let you guys guess. I bet you'll be able to guess 10 of the 15 pretty easily. But
It's funny.
so
Kansas is not in there. They sued
That's right.
Some vaccine
They
companies
sued the
for
vaccine
COVID.
company, yeah.
And they are not on the list. They did not sue. Just so
they aren't. You're right. You're right. No, you'll know these are
you probably won't be surprised.
East Coast and West Coast, basically. Yeah, and then there's a couple of northern states, I think. Anyways, I'll read them to you. I'll read you the states. 15 states sued seeking to nullify January changes that reduced routinely immunized diseases from 17 to 11, arguing changes weren't science-based.
I love how they throw that around when it's just not the science they wanted.
Yeah.
It's not that they didn't do their due diligence. They did.
First off, all they did was reduce the mandatory ones.
Correct.
So now they're saying you can still get all 17, but we want you to make sure you get at least these 11. That's all they said.
Yeah.
So why are you upset? Educate your people.
I can tell you why they're upset. Because those other vaccines, they are pushing they're putting the responsibility of decision making into the parent's hand, which is exactly where it should be.
Right.
So that's what they're mad about. They're mad that they no longer get to mandate that. That means that some of these pediatricians' offices that want to kick people out because they won't follow the vaccine rules.
Did you watch the State of the Union address by Trump? He was talking about he told the story of this little girl who wanted to transition, and parents were against it, and so the school took her away from her parents and helped her. And so Trump said, I want to outlaw that kind of thing because
100%.
Kids should not be taken away from their parents for decisions like that.
No.
They should be taken away if the parents are abusive. And
yes.
and half the people in the room were against that law.
That's weird to me.
You know, so you go, if that's weird, this isn't.
Well,
you know, if that's okay with them, then this is definitely something where like, oh no, the government should. You know, I was watching Josh Howerton, our main online pastor, and he said, wherever godliness is decreased, government has to increase.
Yes.
Because someone has to set the stipulations. And so these people are against some being that is all-knowing and all-powerful, but they want to make their government all-knowing and all-powerful.
Right.
By giving them rights over everything and everyone.
Right. Which is super, super, super dangerous.
I told you we were getting political and we got religious too. So the lawsuit also challenges replacement of members of ACIP. That's the Advisory Committee on Immunization Practices. Administration says HHS secretary has authority. So they're saying they have authority, but the people, they call it's not scientific. But the only basis they have for saying it's not a scientific decision is because they didn't use this ACIP committee to make the decision. They just made the decision. And so they're saying you didn't use your advisory committee.
Okay. Well, they weren't advising properly. So
it can't be. And apparently the HHS replaced some of the members of the ACIP also.
Oh, so they've lost control. And
Right.
That's what they're mad about.
And the article notes concerns that changes bypass the usual ACIP evidence review process and that state requirements and insurance coverage typically track the ACIP recommendations. So money is involved here because they're talking about insurance companies.
Exactly. And there's so much to this that makes me frustrated. And you're right. I think it really, the bottom line is it's about money and it's also about control. Those are the two big things, and they always go hand in hand with something like this.
Yeah.
So.
I was surprised that New York is not on the list.
Oh, yeah. I'm surprised about that, too.
I thought number one would be California. They're on the list. And I thought the second one would be. Now, the suit was initiated in California.
Yeah. Well, I think New York's busy with a lot of other stuff. So.
New York. Oh, yeah. No kidding. No kidding. They have their hands full. Administration's legal argument or authority is distinct from scientific argument evidence. So I just said this. Basically, is they call it a scientific thing, but it's not. They're addressing the legal aspect of whether they have the right to do that or
Well,
not.
probably the reason why they went outside of the ACIP, my guess would be the ACIP hasn't done anything but add vaccines to the list. When was the last time they actually went back and looked at the efficacy
Right.
of each one? Clearly they haven't, which is why somebody's been replaced.
Right.
You
And,
weren't
and
doing your
don't get
job.
us wrong. We're not telling you they're effective or not. We're just reporting on this.
But I can say the groups that are supposed to evaluate it, clearly there was something that they were not doing, which
Yeah.
is why members got replaced.
Yeah,
If you're not doing your job, give up your seat.
I agree. So, my suggestion is do your research and figure out what's right. There's
Finally, we're given the opportunity to do that on some of these.
yeah.
That wasn't always there.
There was a docu-series called Vaccines Revealed, which is probably like 10 episodes of almost 2 hours of interviews of experts on vaccines. And there's another docu-series called The Truth About Vaccines. Now, obviously, you're not going to hear about this in mainstream media, but they were very popular. I think they had millions of viewers and followers and so on. And those are two areas where you could get some of your information and make your own decisions. But if you're contemplating the vaccine issue, just watch things like that and look it up and see who's right, who's wrong, and what they say, and then decide who you agree with.
Yeah, and go to an unbiased source. So nvic.org is an awesome portal of information on every state's vaccine policies, ingredient list for all of the vaccines, any adverse events tied to a vaccine. All of that is there. This is information that you are supposed to be given anyway prior to a vaccine ever being given or administered. Unfortunately, that does not always happen. Sadly, I think it happens less than it should. So go to those places. Go to nvic.org.
NVIC is National Vaccine Information Center, I think. Yeah.
Yep. And just it's a nonprofit. They are not owned by any entity that is going to profit from it. So just go and look and make decisions for yourself. That's what this is about.
So let me tell you the states. It's interesting. Let me read it from this list. All right. I'm going to read you first the Democratic-led states that are in the lawsuit. California, Colorado, Connecticut, Delaware, Maine, Maryland, Michigan, Minnesota, New Jersey, New Mexico, Oregon, Rhode Island, Wisconsin, Pennsylvania.
Did you say Arizona? I didn't hear you say Arizona.
No, because
Okay.
I was reading the Democratic-led states.
Okay, gotcha.
Now, Arizona's on the list. So I read 14 of the 15. The 15th one is Arizona, and it's also Democrat-led at the time of the lawsuit.
Okay, interesting.
So that's the only difference. So there are no Republican states in this 15-state lawsuit. The lawsuit was organized primarily by Democratic attorneys generals. So if the state's attorney general was Democratic, they joined the lawsuit. It was co-led by the attorneys general of California and Arizona, Rob Bonta and Chris Mays. And governor of Pennsylvania, who is Josh Shapiro, who also joined the initiation of the lawsuit. Why they filed? States argue that federal government reduced the recommended childhood vaccines from 17 to 11, bypassed the normal advisory process, particularly the Advisory Committee on Immunization Practices, and replaced the committee members and changed recommendations without following proper scientific review. They claim this could reduce vaccination rates, increase disease outbreaks, shift public health costs onto states. The federal government has denied the claims and called the lawsuit political.
I would agree with that.
There you go.
So
we got
for right
political.
now, we still have some autonomy. So enjoy it while we have it.
Yeah, what would they have done if the HHS said there's no mandatory vaccine? Vaccinate what you want, talk to your pediatrician, do your own research, and
They would've lost their
decide
minds.
if you just want polio or if you want MMR and polio, if you want DPT and MMR, pick what you want.
Oh.
They would have a field day at that point.
Oh my gosh. I could just imagine
The funny thing
the
is
horror.
these states, these 15 states probably have the highest vaccination rates to begin with.
Probably.
And then you've got
If you don't have exemptions,
Florida removed all mandates.
that's amazing.
We're going to have two separate countries. Everything is so divided.
It's very divided.
All right. Are we done with that article?
I think.
All
Do
right.
we have anybody left listening?
Now, speaking of doctors, maybe you forwarded the last segment. You didn't want to get political, religious, and talk about controversial stuff. Here's something that's also controversial. This one
Thanks for tuning back in.
That's right. Come on back. This is the title was When the Doctor Needs a Checkup. And this was at the end of January. So this article is over a month old, but I thought it was interesting because they're basically talking about aging physicians. So the data says that older doctors, which is 65 plus, so the number of doctors that are over 65 increased from 11% to 22% over the past 20 years.
Mm.
So we have double the number of older doctors. I mean, that kind of tells me that they're not retiring. Probably because they can't.
Mm.
They're paying too much on malpractice.
There you go.
Who knows?
Although I think that's picked up a lot. By
Then
the
again,
hospitals.
I'm not retiring. I'm not 65, but I know if I'm 65, I'm not retiring. What am I going to do? We can do more podcasts, I guess. But the physician workforce is aging. Some hospitals require late career clinicians to undergo cognitive physical screening. Why the heck not everybody? You telling me that if you're below the age of 65, you can't go crazy?
I was thinking the
You
same
can't lose your
thing.
mind. You can't get dementia.
Because I was thinking about, and for me, I don't even, sorry, I'm just going to say this. I don't think asking someone who could have a cognitive decline to have a test, I don't think that's ageism. I think.
No, I don't think there's anything wrong with that.
But I'm saying they do. I mean, in the study.
The article is a little.
It's a little skewed.
It's actually maybe just a little bit. It's trying to present both sides of the argument. Like it gave an example. It said there's a surgeon over 75 was evaluated. The test showed mild cognitive impairment. He was moved out of the operating room, but continued clinical work with accommodations.
I think that's perfect.
Okay, but cognitive means up here.
No, I understand.
That doesn't mean his hands were shaking when he's operating. That means his brain's not working right.
Well,
so he's still a doctor. He's still practicing. He's just not cutting people.
Well, but we don't know. They didn't define what the extent was, right? Is it a cognitive decline that leads to motor issues?
Yeah, I guess he could be like,
Do
he
you
could
know
be a
what I
slow
mean?
decision maker. So
It
if someone
could be.
bleeds out, he couldn't decide quickly.
But in an instance where you're seeing a patient and they're coming to see you for something and it's not super acute or it's not like OR necessary, I think if he uses a little bit of a slow decision time, is that really an issue when you're sitting in front of someone? I'll tell you, I'd much rather him take a few extra minutes, any doctor, even without a cognitive decline, because most of them are so fast, they don't even look at your chart.
I tell you, having said that, I prefer an older doctor if I ever need a doctor.
More experience, yes.
Yeah.
I'm
Nothing
actually
beats
sad to see
experience.
some of these older doctors go because there are just some things they know and they see especially
Right.
ones that have been in practice for 50, 60 years.
How many times do our doctors come to me and say, how did you know to do that?
Yeah. Yeah.
And it's like,
It's
well,
just
because I've
experience.
seen it before.
Yeah.
And I tried the other stuff and they didn't work.
Right.
The conventional things didn't work. But then I tried something else and it worked. So next time I see that, I know exactly what to do right off the bat.
Yeah.
And they're always surprised. How did you know that? Why did you do that? Where did that come from?
Well, I was training the team on something the other day, and I was like, I'm really trying to shortcut you. These are things I've learned over 20 years of doing this, and I don't want you to spend 20 years. I may not have you for 20 years. People don't stay anywhere for 20 years. So, let me give you this information. Can I give this to you in bits and pieces, and you don't view it as criticism? You just view it as fine tuning. I don't want you to have to spend as much time as I did figuring it out. If I already have it figured out, I want to give that to you so you just know.
Yeah.
Right? That's how it should be.
I would love for middle-aged doctors to pair up with an elderly doctor
How great would that
and
be?
work together.
Yeah.
But then, like, insurance isn't going to pay two doctors to work on a
Correct.
patient.
Well, and here's the other issue is that we have this problem in our culture where we do not value
Yeah,
more mature humans.
correct.
We do not treat them as valuable as other countries do.
Right.
And I think that's a shame because we do lose. There's so much information that gets lost. I mean, quite honestly, I believe that the history that we see in the books is not the history that's happened as it was. But we don't know that if we only read the books that this one particular person wrote versus the people who lived it. Talk to the people who lived it.
Oh,
You're
yeah.
going to get probably a very different story
Right.
than what we've been told otherwise. So, but in regards to this, when a doctor needs a checkup, I think that should be done all the time. I don't think the biggest problem is aging physicians. Yes, there's a lot coming out, but what about those doctors who are overworked? They're working multiple shifts back to back.
Yeah.
There's a cognitive decline with that. I just saw a story about a nurse who declined her second 12-hour shift back to back. Like she had already worked 8 and then was asked to work another 6. Yes, another 4 hours. So she tacked that on. And then they said, we need you for another 12-hour shift. And she's like, I cannot do it. I haven't slept. I'm exhausted. I don't have it's not safe. They fired her.
Wow.
Right? Well, don't worry. She won that lawsuit for sure. Because you're literally putting, payroll dollars over patient safety, and that's absurd. So, but it's not that that's the only time that happens. What about those doctors who are using drugs? That happens all the time.
Right.
Right? And I'm not saying
I think
90%
there
of
should be
doctors.
an annual assessment
That's what I
on
think.
any surgeon,
Yes.
any and every surgeon, or and emergency room
Yes.
personnel, whether they're doctor or a nurse
100%.
or anesthesiologist, or
Yeah.
they should have cognitive impairment testing
Yes.
done,
So it's not just age. There's-
emotional
Oh,
testing.
yeah. The stresses of certain positions, like having the position of a doctor or a nurse or any position of leadership where you
Right.
are responsible for people's lives, you're
Right.
responsible for their deaths.
I mean, aren't
That's stressful.
firefighters have a physical
Oh.
exam, right?
Yeah.
They have to pass training.
Yeah. I think they have to re-up. Like in the military, you have to pass your
I think,
PTs
yeah.
and stuff.
Yeah. So how's that different for doctors? So that's my suggestion is,
I think that's great.
you're worried about ageism and discrimination. Now, the other thing they mention is disability discrimination. Like if their doctor's disabled, he's missing an elbow or something, and he's.
Or dementia. I've never seen anybody miss an elbow, but I'm sure that could happen. It makes it hard to do this.
That's right. or put your elbow in your ear. You can't do it.
Nope.
So, but if a doctor's disabled, it's the same thing with they were talking about one of the biggest airline, I think, was talking about how we can't discriminate against mentally handicapped people who want to be pilots. I don't want to be on that airplane.
Right.
Nothing against the guy or gal that's mentally handicapped or,
Right.
you know, I don't want them flying a plane with thousands of, well, not thousands, but hundreds of people
That
on
would
it.
be a big plane.
It's a big plane.
Yeah, I'm with you though.
They can sit in the back and we can give them one of those fake steering wheels they can play with.
Yeah, I mean, we have to, people have to be equipped for the positions that we're putting them in, right?
It's not
Like,
discrimination.
no, I don't want somebody who is not certified to fly a plane to fly a plane. If you
Right.
haven't had that education, or you have something that prevents you from doing it well and doing it safely, it's not the position for you. There's plenty other things in this world that everyone can be great at. So go find your thing and do it, and then do it so good that no one else can top you. And that's not it's not an ego thing, but it's an excellence thing. I think if everyone held themselves to a higher standard, I know sometimes it probably feels to our team that maybe we're nitpicking on something, because we never want the little things to fall through the cracks, because when the little things fall through, the big things fall through.
Mm-hmm.
Right? Those cracks get bigger, and then there's no consistency. And so that's really big for us in our businesses, is making sure that all of our core values are held to by everyone in the practice. If you can't hold to the core values, then you don't have to be here. It's okay. I'm sure there's another practice that would be better for you. But you have to have standards, and you have to be okay not ever lowering those standards for anything, right?
Yeah.
Because patients' lives are on the line. That's important.
Absolutely. And I want to just caution everybody that if you are in a room at the ER or wherever, and an older doctor walks in, that you're safe, you're
Yeah,
fine.
for sure.
You know, you're probably better off with the older doctors, because they've been around, they've seen the things that have come around. My dad was born in 1923. He went to medical school in the 1940s.
It's crazy.
And like, he would tell me things of how they used to determine if someone's blood pressure was too high or too low. And other, anyways, I don't want to get too much into that, but it seemed like there was more scientific data back then than there is now, because we didn't have drugs for everything.
Right.
So anyways, and then there's the Lancet, which is a reputable journal, talked about how dementia is preventable, and they have these risk factors that you look at to make sure that the person's not, and I don't know why that was part of the article, which is hilarious, because here are the 14 modifiable dementia risk factors. One is low education. I go, if they're a doctor, how can you say they have low education?
It's funny.
And then hearing loss, high blood pressure can lead to dementia, smoking, obesity. We do have a lot of doctors who smoke and are obese.
Yeah.
Depression, physical inactivity, diabetes, social isolation, excessive alcohol consumption, traumatic brain injury, air pollution exposure, vision loss, and high LDL cholesterol.
One study shows that 21.4% of female physicians abuse alcohol.
One in what?
21.4%
Ooh,
of
wow.
female physicians abuse alcohol. 12.9% of male physicians.
So almost double, exactly double, right? Or close to double women over men abuse alcohol.
I have theories as to why.
Are you going to share?
It's going to make a lot of women very
Okay, but you're
mad.
a woman, so maybe you can say it.
I think it's because our culture has created it was part of the whole female, like putting females so far ahead and us needing to compete with men.
Oh, so you mean the job is so stressful, they don't know if they can take care of their family and...
Well, most of them have families, and
Right.
I'm not saying women can't do it. I think we are built to be able to do amazing things. I do a lot. I carry a lot of guilt sometimes for as much as I put on my plate, because I don't know if I'm doing too much and not doing enough for my kids.
Right.
So I don't know how any woman has a full-time job, even a part-time job, or has that much responsibility and doesn't feel or wonder
Right.
it's a big struggle.
I can
I
understand
think it's a
that.
huge struggle, just like I think men who their family structure either choose to or it works out that they're stay-at-home dads. I think that's harder emotionally for them because that's not how they're built. So I do think that there's a way that specifically that God designed us, and I think that we do have roles that are built into the fabric of who we are. And I think sometimes when we push those boundaries in other directions, it can make us feel like not ourselves or like we're not enough or we're not good enough. And I think that's the culture. So I never want women to think, I don't think we can do things. I do think as a woman, as a mother, as a wife, it is very hard to do it all.
Yeah.
And I think 50 years ago, the expectations were vastly different,
Hmm.
right? But we needed to compete. We needed to be the same. We needed to be that. And it has put us into a society where everyone has to work. No one's home taking care of the kids now. Where are the kids? Right? Like there's all of these things that we've all fallen into.
Yeah.
Technology is now taken over, and now that's teaching our kids sometimes more than we are, and
And I
entertaining.
think our generation, our age group, when it comes to taking care of kids, once kids got to a certain age, the parents just stepped back.
Mhm.
Who was home when you came home from school when you were, let's say, 14 years old?
Oh,
Nobody.
oh no.
They're like, she's old enough.
Oh,
We
it
don't
was
have.
much younger than 14.
Well, yeah. So yeah, 12, whatever. For me, it might have been, I think for me, it was 11, 12.
I
Come home. Nobody's
like 8 or 9.
Nobody's home. You know where the food is. You can feed yourself now. You
Yeah.
don't need a diaper change.
Yeah.
You don't need someone to tell you to do this and that. You're literally free to do whatever you want. And that was our generation. So
Yeah.
we'd go outside.
Yeah.
We didn't have electronics to keep us in the house.
The Atari just came out when I was young.
Right.
So,
and
that tells you.
And I had Pong. I didn't have it, but
Yeah.
like Pong was like a family thing.
Yeah, you played it on the TV.
So, anyways, but I think when your kids need you the most is when they're in that impressionable age of around 12 all the way through 18.
Yeah.
That's when they need a parent there to influence them, talk to them, be there for
Now
them.
there is that first 5 years of life that is super,
Well,
right? But we are
yeah.
always there because
But
they're little.
Yeah, so if you're a female physician and you have a toddler at home or an infant at home, you are going to feel guilty because you can't hold them all day. You can't nurse them
Now
or whatever.
I do know families. I have a very dear friend of mine who's an OB, and she's amazing. And her husband is a nurse, and they make it happen. But do you know how they make it happen? They make it happen in a multi-generational household,
Mm-hmm.
right? Which is that again is going back to the times where it literally took a village, people, and that village was your extended family, and that extended family either lived on property or nearby, so it was walking distance, and there was never not a continuity of care for people that
Yeah.
were in the family. And so so that's why I think that that would be one of the things that I would think of first, is that I think for women to be out in the workforce as we are in positions that are so require so much of us, I can see why that number would be higher.
Yeah.
So sorry,
Well,
ladies, just my opinion.
I don't know if we want to get to another article. We probably don't, because this one would take a little bit. But it says what high blood pressure does to your body, and I don't know if everybody's interested in that or not. But there's so many flaws in this one, where they don't really understand what blood pressure is.
Yeah.
And so,
Well, I think we could put that into the next podcast and really expand on that, because there's so many things around blood pressure
mm-hmm.
that is unknown. Some people go, "Oh, my blood pressure was so high when I was doing XYZ," and I'm like, "Well, it should be." Like,
Exactly.
if you're scared or you're exercising or you're like, you do want it to come up and down. And so I think it would be good to maybe do an expanded time on blood pressure next time.
Okay.
There's a lot that goes into it.
Yeah, unless y'all aren't interested, just let us know. And when I'm sure there's going to be tons of material next time. So, and you kind of hit the gist of it is that blood pressure should be variable. There are times where it needs to be high, and there are times where it needs to be low, and everything in between. And artificially controlling it is not healthy. So that's the summary of it. We'll think about whether we actually want to spend time on the podcast or not. Something bigger comes up, we'll use that one instead. So. Anyways, bless you guys. Thanks for joining us. Thank you for participating. And I know there's some of you who watch every single episode, and I'm just grateful. And just we love and enjoy spending time with you. So we're praying that you're safe and healthy, and we're expecting to see you again next time.
All right. Take care. See you next time.
Live radio, local podcasts, the Frederick Podcast Network at listenfrederick.com.